All right, welcome back to the DocBuddy Journal. I'm your host, Kiera Helms, and in today's episode, we're exploring a nonprofit whose mission is to ignite the spirit of service and transform the lives by expanding access to high-quality surgical and primary care around the world. That is the heart of One World Surgery. Joining me are Dr. Peter Daly, an orthopedic surgeon, and his wife, Lulu Daly, a pediatric nurse. Together, they've built something truly remarkable. What started as a single act of service has grown into a global effort that now serves more than 27,000 patients each year and engages over 1,500 volunteers annually. This spreads across Honduras and the Dominican Republic. Peter and Lulu, thank you so much for being here today. Lulu, I'd love to begin with you and hear how this all began.
Thank you for having us. We're excited to be here. So our journey started really when we met in college. We always wanted to do global health, and Peter was in pre-med. I was in nursing school, and then life happened. We got married. We had kids right away, and we weren't able to really do that. But in 1993, we were exposed to a children's home in Mexico that we went to visit, and we loved it. And so I was just more involved with the fundraising part of that. But one Christmas Eve, I had called the priest that was the head of the home in Mexico and all the other homes. And I asked him what he needed for Christmas. And he said, oh, I need this, this, this. And then he said, well, the home in Honduras needs a special needs home for the special needs boys so they can be together and grow in a healthy way. And so I was very interested in that because Peter's father was an orthopedic surgeon, and at the age of 46, he was in a head-on collision. And when that happened, he had really a mentality of a 7-year-old, and he lived like that for 28 years. And so if he wasn't living with us, he would, there was a group home that was like a respite care for us. And it was so beautiful, and we needed that in our family. So I said, what a great mission to do. So we said, yes, we would like to help with that. And then, about 6 months later, we were in Nicaragua and at a board meeting, and Reiner Kohler, who was the head of the Honduras home, said, aren't you the Dalys? Don't you want to come and see what you helped build? And I said, well, the only way we'll come is if I could bring my 4 young children and Peter and I can work. So I don't think he really believed that we would do it. But 3 weeks later, I had our tickets. We were going, took the kids out of school. We were going to Honduras. I didn't even know where Honduras was, but we were going. And so we went, and when we were there, they were opening up the special needs home when there were 8 beautiful, beautiful boys. And they asked us to name it. And I'm like, no, I don't want to name it. Have the boys name it. Wow. So they had the ribbon cutting, and they cut the ribbon, and they said, this is Casa Emmanuel. And we looked at each other because that was Peter's dad's name, and nobody knew us. Nobody knew who we were. And so we knew we were standing on holy ground. We knew this was it. And so we just embraced our 2 weeks experience there, where my kids were at the school, on the farm, working, having fun really on the ranch with the 500 kids. And Peter and I were working in the clinic. And when we were there, we were introduced to a little girl named Angela. And she was 9 years old. And she had, what's the name of it?
Yes, a condition called chondroectodermal dysplasia, which caused the deformity of all her growth plates on different bones. But her worst portion affected were her knees. And so her knees were at such a 90-degree angle the wrong way that her legs had to scissor. And she really had gotten to the point of a few years of looking for some solution that she wasn't able to really, she used a wheelchair much of the time.
So Peter was operating, doing like lumps and bumps in the back of a
semi-truck trailer.
Yeah. And so,
and that was really, it was a beautiful effort of an ambulatory surgery center, actually, because It's so ambulatory. There were wheels on it. It was a semi truck trailer, and so it was. We knew that we couldn't do the surgery in that small little mobile operating theater, and the surgery she needed was extensive, and so she came to. So I said, "Well, let's come to Minnesota. Why don't we bring her to Minnesota because they really hadn't been able to access any inpatient facility in Honduras to get it cared for." So she came to Minnesota and lived with us for a year and had multiple surgeries and stages on both lower extremities. And by that time, she was just part of our life. She lived with us.
So when she
Yeah.
first came, Peter told me it would be 6 weeks. And I thought, okay, I could do anything for 6 weeks, but it ended up much longer. But what happened was when he had to break her legs in 3 places and then put those external fixators on. And
that's called an osteotomy.
Okay. And then he had to put all these pins in. And so there were 36 pins, 18 on each leg. The only thing that made me nauseated in nursing school were pins, and he forgot to tell me that that's what was happening. So after she came out of surgery, I had to sit down because they pulled it back and there were all these pins. So then I said, now what do I do? And he hands me a piece of paper and he goes, well, here's a printout. You have to turn the pins every 6 hours. So I'd have to turn 2, 5 and 18, and you turn them just a little bit every 6 hours, and then her legs would become straight.
And it was so the correction happened gradually so that the nerves and blood vessels and other soft tissues could correct gradually and not happen so abruptly, and they could adapt to it. But I have to give it to Lulu because, every 6 hours, around the clock, 24 hours a day
for 4 months.
For 4 months. I mean, she really did. And then I kind of went about my regular job.
As always.
And she was working.
But anyway, so she really became part of our family. And she lived with us for a year. She went to school. She made her first Holy Communion. She did everything that our family did. She called herself Angela Daly. But then it was time to take her back because the children on the home aren't adoptable. They're raised as a family. And she had a brother and sister there. So life changed. It was really terribly hard on our family to bring her back, but we integrated her on the ranch for a couple of weeks just so she'd get used to being back home. And then she said something that changed her life. As we were saying goodbye, she came out and she went to school, and then she came out of the classroom and she started sobbing and she said, "Mommy, stay with me." She didn't say, "Take me back home to Minnesota. I want to go back with you." She said, "Stay." And I turned to him and I'm like, do something. And the concept there, we didn't have this big vision. We're not these visionaries or whatever, we had nothing like that. It was just do something, like build a small room so we can come back every year and be a part of her life. And that truly was the beginning of how it all started.
Yeah. So, what's unique, and I guess what I would love the listeners to understand about this is that our healthcare, our surgical facility in Honduras and now the DR is an ambulatory surgery center solution to a gap in surgical access globally. Okay. And most of the time we think of, interventions for people that don't have the resources to access surgical help as being needed to be done in a traditional hospital. And there's been so many advances in the United States and other high income countries that have migrated things that were traditionally done in an inpatient traditional hospital setting to an outpatient setting because of advances in anesthesia care, minimally invasive surgical approaches, different medications that have been developed. And I had experienced that in my own practice, my orthopedic surgery practice in the Minneapolis-St. Paul area throughout the 90s. And so I was the medical director of 2 surgery centers at the time we were beginning this 20 years ago in Honduras. And I'm like, gosh, we could apply an ambulatory surgery center model right on the children's home. And that would be, a win-win on multiple levels. It would allow us to be part of Angela's life because we'll be frequenting the development and building of this. And it would allow us to find a solution for what Angela couldn't connect. And the third thing that I think was what we were looking for as a family was that we had volunteered in Orthopedics Overseas, which is a wonderful organization. There are some opportunities for family involvement with that, but I hadn't found the exact locations that it worked out well for our family. And so we needed something where our family could serve together. And this is how it came to be, really. It was out of necessity of wanting to do this together in a safe way. And being on this children's home and having that facility there that we were building out was perfect. So that build out kind of happened from 2004 to 2008. And then we started doing surgery there, 3 to 4 times a year at 1 week sessions. And that built up to maybe 6 to 8 trips a year. And there was a medical student who had grown up on the orphanage. His name is Merlin Antunez, Dr. Merlin Antunez. And he was a primary care physician. And when we would come and go with these different trips, and we'd need orthopedic follow-up and other general surgical procedures that were being done to be cared for, he provided the follow-up. And we kept encouraging him. I was sort of marinating his mind in these orthopedic principles. And I said, why don't you go back and do a residency in orthopedics there in Honduras? There's a residency training program there. And he did. And so he became the medical director, has become the medical director of our home, which he started with us in 2014.
So in the beginning of all this, it was just our friends and family that would come. We'd ask anybody to come with us and run these brigades. And so when we would go 2 weeks at a time in January and in June, and then people would, our friends would come 1 week at a time. So we were doing our first surgery. We did 2, and then we'd do 1 week, and then we were adding a little bit here and there. And then it was starting to really grow. And it was getting a little bit over our heads. So we decided that...
we had a number of partners by that time, different groups, Dr. West and
right. But now, we were just literally doing this in our kitchen, and all the supplies and everything was in our garage. So we were doing it, but it was getting big and over our heads, and so we Peter and I went on this 8-day silent retreat. And out of that retreat came like, okay, let's go forward. But now what? We got to pray that someone comes in our lives. And lo and behold, 2 months later, SCA came in, and it was a game changer, because when they came in, they gave us all the help we needed to really make this grow.
Well, and SCA stands for Surgical Care Affiliates. It's an ambulatory surgery center, part ownership and management company that then advocated to their 250 ambulatory surgery centers that they managed at the time to join in this mission and volunteer with us and help support and help get other health professionals to do that. And so that was in the end of 2014. And then it just was like we were on steroids from there on out. And, breaking home run records but wow. just increasing the amount of people and missions and supplies and all the different challenges that go into this to make it sustainable, and just broadening the support both in personnel and energy, for love of the mission. Anyway, long-winded answer.
Oh, that was incredible. What an incredible story and an origin. And it truly speaks to how much you guys care about this and the foundation that was built on. That's amazing. How do you think that One World Surgery fits into the larger conversation about global health, especially when it comes to surgical access in these underserved areas?
Well, I would say, that's a good point, because there are a number of global health efforts. You think of Doctors Without Borders, and that mission in particular goes to conflict heightened or acute conflict areas that you really can't bring a family to, and there's a lot of security and safety risks, and so there are other organizations that have outreach in primary care missions, or setting, I've heard Global Medical Brigades is another one that encourages college students to go and volunteer and do outreach into local villages and things. But a surgical mission is rare. And when I say rare, because a lot of public health focuses historically on infectious diseases for excellent reasons. I mean, tuberculosis, HIV, malaria, those are very hurtful and deadly conditions. But surgical medical missions haven't really been emphasized in a public health standpoint. Paul Farmer and Dr. Kim have called this the neglected surgery is the neglected stepchild of public health, partly because of the focus on infectious concerns, but partly because of the misconception that it wouldn't be cost effective to provide things that require a sterilizer and sterile conditions and operating rooms and a backup generator and all of the equipment intensive activities that are required and resources. But there's been several studies, including one of ours that we published in 2017, that shows that it is cost effective. It's as cost effective as addressing cardiology care and and some of the other non-surgical interventions. But you need to have a stable base and continue to go at a same site location, so that you're not kind of falling into the medical tourism of not being able to sustain long-term results. And so, in answer to your question about where do we fit into the scale of public health or global health, we fit in the spectrum by having a permanent facility in Honduras, and we now have a second one in the Dominican Republic. We also fit in to only serving those that cannot pay, and that's been a key to our success. I think there's a plethora of people who can't afford the surgical concerns that they have, and how to fix it, and that's our only substrate of patients that we serve, and therefore we don't get sideways with the local medical communities in which we live that are making their living on other more traditional ways, and we can take care of that population that is falling through the cracks. Lulu's father always used to say, well, why do you have to leave Chicago? Why can't you just go to serve in Chicago or stay in the United States? And she said, well, Dad, the U.S. has all kinds of safety nets for people that don't have access to things. You can show up in any emergency room at any time and by federal law have to receive treatment, regardless of ability to pay. Whereas in these other countries, they don't have the safety nets. They just don't get the care, and they perpetuate their disability, which perpetuates their poverty from an economic driver standpoint and being able to make a living for their family. And then the whole family can kind of fall apart. So that's the niche we're serving. The other niche we're serving is having a place where you can serve with your family, and you can serve in a facility and and a location that has its roots deeply in that country, that's not going anywhere. So we know that when we serve in one of our One World Surgery sites, that the patients there will have continuous sustainable care. We have an in-country Honduran orthopedic surgeon. That's Dr. Merlin that I referenced. He's our medical director there. We have 80 full-time staff that are Honduran that work there, that are there day in and day out, whether they have a visiting team or not from outside the country. And they're providing beautiful care. So family involvement, permanent facility. And the other thing I think that's a key to our success is it's a facility that we built. So we're not beholden to a public health facility in that country. Not that it's horrible or anything, but they lack some resources, and they depend on government funding. Honduras is the second poorest country in the Western Hemisphere, only behind Haiti. So they just don't have the government funding for all the things that are needed from the healthcare of their villages and communities. So it's a ripe place to participate.
We're not that smart. We didn't know. We just kept saying yes all along the way, really, because when we were building it, we really wanted to do something with our family. I didn't want them going off, to a different country without us. We tried it once with our kids and it just didn't work. And I had to leave early, and there was no way I was going to he was gone all the time anyway. So there was no way I was going to let him go again without us. So basically we found something that really made a difference in our family. Our kids grew up there, loved it. Their lives had been changed forever from going there. And it was just a great experience when they were young. And so we wanted to share it with our family and friends. Like a lot of my brothers and sisters came with their kids, and our best friends would come with their kids, and it really grew into more of a family experience, which we loved. And the best advice we had ever gotten was from a doctor that said to me, do one thing and do it really well. And I remember that, instead of going here and there and all over the world, 1 week at a time. And really, we were growing it, just keep saying yes and doing what was in front of us, the next right thing. And so that's how it really grew to where it is today. Wow.
What an amazing story. And all of those principles that really have founded One World Surgery are so clear in the way that you talk about it. What factors do you think are essential when building an ethical and sustainable program like this?
Well, first, just what you said, it needs to be ethical. You need to respect the culture in which you're working. And, you can't just show up and say, well, I've got this hammer and everything else is a nail. You have to find out what solutions they need. We did a research study when we decided to go to the Dominican for a second site, after being invited to help there as well. And we hired some college students that had started a separate nonprofit to canvass the villages and the communities around the area of what surgical conditions they needed the most help with. And we published that paper as well, but it had to do with ophthalmology, general surgery, and orthopedic surgical conditions. And so those are right up our alley, and things that we could provide care for in an ambulatory surgery center facility setting. Mm-hmm. And then also we realized that we really had to apply more primary care access as well to complement the surgery. So it's really, I like to say, it's like an Oreo cookie. You've got primary care on one side of the Oreo, surgery on the other, and the filling in the middle is the patient. And so
that's always the good part.
Yeah, and I love Oreos. So I think that we needed to really address the whole patient, and that's evolved beautifully with some of our partnerships, particularly with with SCA and Optum, Humana, and some other partnerships that we're also looking for ways to find meaning in volunteering. I guess I want to mention one thing about short-term medical mission volunteering that's had some criticisms, appropriate criticisms, about whether it's sustainable and done ethically. And we've taken a lot of those considerations in as we've designed and evolved and matured in our nonprofit. But so many people have personal obligations of making money to pay for their house payments and sending their kids to school and all kinds of things. And so we just all can't be Albert Schweitzer and go do this full time. But yet a lot of people have the desire to volunteer, and they have medical training, or they just want to work in a nonprofit that is perhaps healthcare related. And this allows for that when you're doing short-term medical missions. But you have to really design it where you provide the appropriate safety and security measures. You maintain best practice standards that are going to honor giving the best to the patients we're serving there and not cutting corners on healthcare. It has to be something sustainable with consistent follow-up of patient care, and you're not just dropping in and dropping out. And that's so key with having the local health community working with us and as part of the program. And I guess the other thing I would say is that in the design is that we have 3 pillars that we want to include in One World Surgery. One is best practice healthcare facility, which is the surgery center and the primary care clinic. Number 2 is direct patient care and providing at the best practice standards. And number 3 is to emphasize education. And so we do have an orthopedic surgical fellowship, year-long fellowship program. We have an ophthalmology year-long fellowship program, both in Honduras. We have different scholarships and training programs for nursing students, medical students in country, surgical tech, training for surgical tech. Our little loved one, Angela, who lived with us, she took advantage of that scholarship program and is now a surgical tech and does sterile processing as well in our Honduras facility. So, all of these things you have to layer in, and it does take some gradual maturation. And not everybody has to start a de novo program.
They can join us.
Yeah, you can play in our sandbox. We would love that. And but at least these are some of the things that you would want to look for in evaluating a program that you want to participate in. Does it have some of these ethical standards and sustainability principles?
One thing we don't want to ever do is deviate from our true mission. And that's really important to us. We serve the poorest of the poor that can't get any help. And I always say the poor deserve the best, and they get the best of the best care. So I love that because, when someone like in Honduras gets in a car accident, then they can't work. And then if they can't work, they can't provide for their family. If they can't provide for their family, the family ends up in the streets. And just by taking care of the neglected surgical care that, you can get them back at work. And so you save a family and you save the community and you can change the country like that. And so it's been really important that they get that kind of care. So then when we were asked to go to the Dominican, I was like, oh no, how are we going to do this again? But when we went there, a lot of people go to the Dominican Republic and they go to the beaches and they think it's so beautiful, but they have no idea the out pockets in the Batays that are the sugarcane people from Haiti that need our help. And they don't have any, if you're born there, you don't, if you're Haitian descent and you're born there, you don't have the country. They're not Dominican. So they're the poorest of the poor. And to go in there and to be able to help them is just a gift to them. And it's a gift to us to be able to serve them, because it's so beautiful, that transaction that comes between the patient and the volunteer, because you can't learn that in books or movies. It's just something that you have to experience yourself, and that's when it's the work of God, because we could have never thought this big. And because we've had so many people that are looking for what we were looking for. That's the funny thing. They're like, we've always been looking for that. Well, we had been looking for that since we were 20. And to be able to share it with everybody has been unbelievable. And It wasn't just us. It took a huge, many people, and continues to grow. And people are looking for that. They're looking for that connection with other volunteers. They're looking for a purpose in their life. They're looking for something outside of themselves. And we have the program. One World Surgery has that program that like I said, we didn't know, we were building it, but it was, and it's beautiful. We have thousands and thousands of volunteers that are like, oh my gosh, this is great. We want to be a part of it. So we welcome everyone to be a part of it, because it truly is, it is wonderful.
Yeah, absolutely. That makes total sense. Speaking of the volunteers and, the providers who are volunteering, I know for them, like you said, it's not just about giving back. It's about talking about the impact that they have and, making an impact on the people that they're serving. Many healthcare providers are talking about burnout or feeling disconnected from the reasons why they went into medicine. How do you think mission trips like these help them feel reconnected to that why?
Well, I think that's just what Lulu was saying, that we didn't realize how pervasive that feeling is that you described, where you just get caught up in the day-to-day machinations of one of the biggest industries in our economy of the United States. At least it's really a big business, which, not that business is immoral or something, but it's just that there's things that you have to accomplish that are obligations, and you lose sight of why you went into medicine. And this is an experience of medicine in its purest, whereby there's no, there's no hesitation of what any motivations are or what might be best. I guess one of the calculations you have to make as a clinician is just knowing what they need, and actually being able to give them what they need in an austere setting, so that you don't create a bigger problem with the proposed solution. That's part of the nuance and the expertise that comes as part of global health, and raising that awareness for people. But there's a poverty of spirit of the healthcare providers, and that's what they're describing when they say, oh, I really want to go do something. And there's an economic poverty of resources and other things that occur in some of these other low to middle income countries. And so combining, the riches from one country and the riches of survival and scrappiness and dedication to purpose for their families that we see in these other countries, we exchange the riches for the different poverties on each side. And it's a win-win. It's the reason why people say, I got more out of this than I gave.
Yeah, absolutely. What kind of feedback have you heard from volunteers after returning home? What, sticks with them the most?
Well, I think it's just the perspective. And they say, oh my gosh, I can't believe what we could do in, where we didn't know many of these people that were volunteering together. And all of a sudden, by the end of the week, you're just all best friends, and you see these great relationships that have occurred. But I think it's the perspective, as Lulu said. You can't read about these things in a book. I mean, you can, and you can see a movie that's inspiring, but an experience does something with you personally, and so gaining that experience changes how you look at your local environment when you get back home. You think about how great it is to have clean water come right out of the tap that you can drink and not cause dysentery or something. And not that that happens everywhere in Honduras, but we're visitors there, so we're not used to their set of circumstances. But you just get a big perspective on on the global effect of what life is like, and that's helpful in being more tolerant of people around us and being more respectful. Um, those are all manifestations that we see come out in our relationships, in the way our kids' lives
Right.
developed, to be exposed to that as they were growing up. That's, again, a big part of something you want to share with your kids.
A lot of times that, we've had thousands of volunteers, and there's a lot of times that I'll be like at the grocery store or somewhere, and they're like, oh my gosh, my life was changed. And sometimes I can't remember them all, but I said, oh, well, what brigade were you on? Because it's changing. What's so wonderful, I think, is when you bring these young kids down, because obviously they're our future. There have been so many kids that we have brought down that have gone into the medical field. Like in high school, I brought 10 boys their senior trip, and 5 of them have become orthopedic surgeons that are in Peter's group.
Wow.
I have
Recruiting.
two niece and a nephew that became orthopedic surgeons. I have 3 nieces that became nurses. So many of our friends' kids have gone into it just because they were exposed to something so pure, so wonderful, so loving, and it was great. And so anytime people say to me, oh, I want my child to experience it, I said, I would love to take them, but you got to come too. Because when you can see it through their eyes, it's so beautiful. It really makes a difference in families coming closer, because they're experiencing something that they can never experience. The children, the patients, the surgeries. I mean, you don't get to see that in its purest form. So that's the beautiful part.
And I would add to that, Kiera, that it's not just medical fields to go into. One of my sons, well, we only have one of our 4 kids that are in the medical field, but they've all grown tremendously in the desire for service. One of my sons is in business, and he knows what it is for a work ethic of service. And anybody wants to hire someone who's willing to do whatever it takes to help the purpose of their business, and isn't above any task that might be needed. So there's a lot of life lessons that you get through service, no matter what field you're in, that is beneficial. And I think that's what people who participate in it enjoy. That
one of our daughters, when she graduated from nursing school, she went down there for 4 months just to do the protocols. When we were opening in 2008, she was doing all that for us, and she was just a brand new nurse. One of our daughters was a teacher, and she went down there and taught for a year taught English to the kids on the ranch, and worked with us when we were there. And our other son, he was going to be an orthopedic surgeon. He was going to take over, but he ended up becoming a Catholic priest. So he prays all the time for us, and we bring him down, and he's been wonderful and a really great support where his parishes. He talks about this at his parishes and brings down youth groups and volunteers. We just went down to the DR with 10 of his parishioners to help us set up our chapel. So it continues to be a family affair. And we even took 2 of our grandchildren down for the first time last summer, and we're going to continue with them because they're dying to go. They're like, when are we old enough to go? And so as soon as they turn, I mean, we started taking our kids when they were really young. So people have been taking them down when they're 3 years old. So it's been wonderful. It's a great family place. So we love it.
It's so clear. That's amazing that it's, so widespread through your family and it's such an impact on everyone that you've interacted with. I think that's something really important to also, remember as we're going through, and for providers that are looking to do this in the future, it's not just about serving the community. There's like lasting impacts that are going to come back with them as they go, through their career and at the surgery center, wherever they're working. I think that's really amazing. Kind of, pivoting onto the next steps for One World Surgery. What are your guys' future plans? What do the next steps kind of look like, and how can listeners be a part of that?
Well, one thing we'd like to do is to continue to deepen our roots in the two countries in which we serve, so that we can be a referral resource. We're already a referral resource from some of the largest public hospital that in final tertiary care pathway hospital in Honduras sends us their difficult cases that they know we've got particular differences in expertise that are present, and also to provide some of the resources for those patients that they don't have the answer for. So deepen our roots, expanding education. We have the fellowships in ophthalmology and orthopedic surgery in Honduras, but also expanded to more of the social year of service. Honduran doctors that come, we right now have 3 per year. We want to increase that to 4. And then also the nursing students that can rotate with us and partner and get mentored with the different clinicians that are Honduran, but that are also some of the visitors from the U.S. and other places. And then provide some of those educational objectives to our newer facility in the Dominican Republic as well. So we have plenty to do. I wanted to also expand on inviting people, certainly of any background. What I love about medicine is that it is such a universal platform for people to bind someone's wound. It's like a natural inclination of anybody to say, how can I help you? When they see a wound that is physical or surgical or, primary care or psychological. And so we have in the world, there's St. Mary's Hospital from a Catholic faith tradition, the Latter-day Saints Hospital from a Mormon history, Lutheran General Hospital, Mount Sinai Hospital, just regular, just entirely secular hospitals in different universities, but they all come together in a medical platform where everybody enjoys serving and helping. And so that's what we want to continue to invite people from any background or tradition to join in that service. And it's been just a beautiful mix so far, and we continue to expand it as well in with people of different skill sets and different resources. Industry, we could never do what we do without some of the industry support that we get from vendors and different companies for which we apply to their charitable committees and get good used equipment or other excess inventory they might have that can help in this setting. So there's all kinds of ways that people can join in on that, and that really will build our future, I think.
Absolutely. For someone who's listening and feels inspired but is unsure where to start, what would be the first step that you guys would recommend?
Well, go on our website, sign up, come on our brigade. You don't have to be medical. We need all kinds of volunteers. I took my mother, who's 93. She's been coming down for the last 5 years, and she goes in the kitchen and cooks. I'm from an Italian family. She loves to do that. But we need all kinds of people to help, just not only medical, but anyone can come and see. I mean, there's some of our biggest donors aren't medical, and they've come and they're like, whoa, this is real. They can see the impact we're having and the difference in people's lives. So we invite everybody to come, and we really would love it. You could just go on our website and sign up for a medical brigade, and
we also have some different get-togethers, fundraising, and otherwise
our
around the
galas
country.
are always fun.
One in Minneapolis, one in Denver, one in LA, one in Salt Lake City,
California,
Chicago. So we're happy to have dinner at someone's house if they want. Or Lulu's
or
a
I
great
can
cook.
cook. You
Yes,
can come here.
I do volunteer her a lot for parties.
No, but that's how it works. With family, that's how it works.
Well, it's about
just
relationships.
come together.
I mean, things are sustained through relationships, and anybody you talk to about, how they're successful at business, well, it's all about relationships and who you know and how you share things. That's what it's about, and that's true of this endeavor as well. That's what makes it so special too, because you develop these long-term relationships with these beautiful, talented people in these countries in which we serve, both the patients, but also the those that work with us, and getting to see these people over and over again each time, and spend more time with them is what it's about.
It's priceless.
Absolutely. Well, you've inspired me. Now I want to go on a mission. All right. Well, for all of our listeners, we will be sure to add all of the links for the Dalys for One World Surgery so that you can donate, medical supplies, sign up for a mission, and find more information about their amazing cause. What an incredible conversation to have. And on behalf of the entire DocBuddy team, thank you so much for listening and being here. We want to make sure that you're subscribed on Apple Podcasts, Spotify, and YouTube so you never miss an episode of the DocBuddy Journal. And until next time, I'm your host, Kiera Helms, and we'll talk to you again soon.
Thank you.
Thank you.